Hi everyone, welcome to the channel. Thank you so much for tuning in to the Think Nursing channel, where we discuss everything related to nursing, travel and lifestyle. So today I have finished my work. I saw about 8 patients today. Started around 9 o'clock and then I ended around 2 o'clock. So it wasn't a bad day. So today I'm going to talk to you a little bit about some of the things that we do in Jamaica that are totally different here in the US. And this is back then, you know, when I was working as a nurse in 2011 or 12. Thereabout, and I stopped working in Jamaica around 2016. So a lot of the things that I describe in my videos are things that were, you know, present during the time that I was there in Jamaica during that time period. Hopefully things have improved a little bit. If not, then, you know, we still ensure that, you know, patient safety is key, and I'm sure the nurses and the doctors and the health sector is doing a wonderful job with trying to ensure, you know, the patients are well taken care of. We never had a lot of IV pumps in Jamaica. In Jamaica, we used to have to go to the IV tubing and look at the bags. Some of the drip rates on those bags are like 10 and some are 15. And then depending on what fluid you're going to be infusing, then you have to get your pencil or your phone and do the calculation. Another thing is that we never really had call bells, so the nurses will normally have to be listening out for the patients, and the patients will stay at the back of the room or the front of the room. Sometimes they'll walk up to the counter, they'll call, and you know, we'll address their needs at that time. We never had individual wrappings for dressing, so most of the time you'll find us with a big container of gauze that we normally get from the central sterile processing unit or department. That nurse usually gets the dressing cart, and go around and do dressings for all the patients that need dressing on that specific date and on that shift. We never had a tube system where you draw your samples or your urine, your blood, and then you send it over to the lab. No, you draw your samples, you put it in a little container, and then we'll have sometimes the nurses or we'll have the techs or the transporter will come and take up that bulk of sample and then take it over to the lab. And then once the results are back, then they'll send it on papers, and then we'll see the result, and then from there we'll continue with management of those patients. We reuse items, so like your bedpans and all, we'll wash them, we'll reuse them. A lot of times we have patients who comes in for admission. We don't necessarily have like a ton of warm blankets. We don't have socks that we give to patients, you know, all the time. We do have a little sheet or so, 1 or 2 times that we normally have, but it wasn't a big deal. Patients come in and they know that we don't have warm blankets, so they just get cracking, and you know, everybody's comfortable just waiting for their care. Another thing is that we never really had a 1-to-4 ratio for patient to nurse. It was more of 1 to many. Yes, so depending on the amount of persons on the floor, depending on the amount of staff you have, you just have it, but it's never going to be a 1-to-4. We never really had this thing called a ratio. No, you just go in and you take care of patients. Whoever did first, you go ahead and sort them out first. Whoever can wait, and that was just the standard thing. We never really had a patient ratio, and so a lot of times you might have 1 nurse to 20 or 1 nurse to 30 or 1 nurse to the entire department if she's the only person on God that show up and is there for work. When you have patients who have had surgery or broken limbs and they get onto the floor, sometimes you have to do weights on them. You have to put weights on their leg to kind of help with the bones to align properly. And so sometimes what we will do is put sandbags on to help with pulling down that weight, because we never really, or pull traction on that leg or limb. So we never really had you know, those fancy looking kind of weights that you hang on to beds and all. No, we never really had that. So our hospital, we never really had a rapid response team. So whenever a patient is coding or anything like that, you just have to go ahead and call for assistance, shout whatever it is that you need to do, and then help will do show up. We don't have an active EMS system, and so when a patient is being transported to the hospital, most of the time they're transported by passerbys or they're transported by family members. Sometimes the police will put them in the van and bring them, and sometimes patients will just show up by themselves, and then that's it. A lot of times we never really had this thing we call vocera, or what is like a communication or a tracker phone. We don't have that. We just know that when you go on break and you see coming back, we know that you're coming back for, you know, for relief. But if anybody needs you, then we'll just take up our personal phone and call. So we never really had anything that track us like that. If we have 40 patients or 45 patients on the floor and there is only 2 nurses, you know that 1 nurse has 22 patients and the other person has like 23 patients, and then you have to sit down and do charting around the clock. We really had a process where we have to go ahead and do, you know, patient rounding every hour and document. No, we never have that because we have too much charting to do. We have too much patients to see, and we don't have enough nurse to actually help with that. When we're calling for report, we never really had anything where we have to fax off anything or we give a standardized report. We just know that there's a bed available and we'll give the nurses a report on the floor and they'll take the patient. Sometimes from the emergency room, the nurses will go to the floor and wipe down those beds and transport the patient and put the patients there because there is nowhere else to put the patient except on the bed that is available for them on the floor. We'll have like a ward assistant and we'll have like, you know, yeah, just a ward assistant and the nurses. So a lot of time the nurses are not able to assist with feeding, and that's because we have a lot of work already doing. So the ward assistants will go ahead and feed those patients. Sometimes the patients do get food, sometimes they don't get any. We're going for work, we don't clock in on a computer. We actually write in a book the time that we check in and the time that we check out. Sometimes, you know, the matron might say, hey, remember to go in and clock out because you didn't clock in for the shift. So over time, we're always there. And even though we weren't really paid well to do overtime, people were just of the mindset that nurses were always staff at the hospital, but they don't understand that some nurses are working 7 days a week to cover some of those shifts. In Jamaica, we did team nursing, and that was wonderful because everybody know what they're supposed to be doing, even though sometimes it looks chaotic and, you know, things not going so well because we don't really have much resources. But yes, it did work out and patients do survive. In Jamaica, we don't really activate anything like a code stroke or trauma. We don't do that because we don't have a system in place to do that. We don't have any trauma team. We don't have a stroke team or anything. In Jamaica, we have more patients than staff, and so a lot of time the patients just cuss you out, but at the end of the day, everybody and you a friend. In Jamaica, we give full bed baths to the patients in the hospital, and at 5 o'clock or 4 o'clock in the morning, every patient will get a bath. 4 o'clock or 5 o'clock patients don't like it at that time because at that time they're getting a bed bath. And when we talk about a bed bath, it's a basin at the side of the bed, and we'll go there and wash it down and change the linens. That way in the morning at 7 o'clock it can look clean and pretty. So in Jamaica, we never really used to have anything called butterfly needle. We just do go ahead and do a regular straight stick and get your blood and send it to the lab. In Jamaica, our time period for lab turnover was never 1 hour. It was sometimes longer than that, but patients were still willing to wait, even though sometimes they're very, very miserable. In Jamaica, we never really have a CT scanner on the hospital campus, and so only dire emergencies the hospital will go ahead and pay for to ensure that you survive. Otherwise, your family member have to go ahead and pay for certain testing, and we arrange for the ambulance to go ahead and take it to get those tests done. In Jamaica, the hospital that I used to work at, we only probably had 1 or 2 ambulances, and those ambulances weren't looking as fancy as the ones that you see here on the road. They were looking more like bread van. Yeah, highest bus. But then I think we got another one that looked like a regular ambulance. Yeah. In Jamaica, we never really had our ambulance services doing any form of paramedic duty. It was more just for transport. Yeah. In Jamaica, our nurses, they do a lot of work on the ambulance. So if you're transporting a patient to a facility, then sometimes you'll have the doctor come with you only under, like, you know, really extreme situation. But for the most part, it's you and the driver and the patient is on that ambulance with a little ambulance bag, and in the event that something happens, then you're responsible to assist that patient. So in Jamaica, our units were always overcrowded with patients. In Jamaica, we usually get medications from the pharmacy, but sometimes if medications are left over from another patient, because the nurses are the ones that dispense it, we'll end up and use it on another patient. In Jamaica, when it's flu season, patient know that it's flu season and they don't come to the emergency room with simple flu-like symptoms. You know, we always send them over to the comprehensive clinic to get seen or treated. In Jamaica, if patients come and their symptoms are not an emergency and they need certain testing to be done as outpatient, our doctors will normally just go ahead, hear what they have to say, and write the referral or the test and have the patient go ahead and get the testing done. In Jamaica, despite everything that has been going on, the relationship between the nurses and the doctors were very, very good. In Jamaica, even though them cuss and go on bad, the patient them appreciate what we're doing. Majority of the staff in Jamaica are working as a temporary permanent position because there's not much positions available for permanent staff. In Jamaica, God bless the amount of money that they give you for uniform allowance, because a lot of persons take it and buy a car now. In Jamaica, we are expected to be wearing white uniform, and if your uniform don't look white, the matron will send you home. In Jamaica, you were expected to be dressing professionally. If you're not looking like a professional in Jamaica as a nurse, then our matron or matrons will go ahead and send you home, depending on the hospital that you're working at. In Jamaica, scrubs weren't allowed in our administration office. In Jamaica, we wear a white uniform, and we wear a white hat, and it was just a part of the uniform. Everybody enjoyed wearing it, and you know, no complaints. In Jamaica, sometimes the nurses don't get any break time because we're working throughout our shift. In Jamaica, some nurses were able to work certain shifts, and so they were able to help out their other colleagues with different, you know, personal things. So for example, somebody need to go to the bank or drop off their kids at school, then they were able to do that because of the relationship they had with the persons that they're working with. In Jamaica, we had a nurse's room that had bed, so that way if you're working a night shift and you want to sleep, you can go around there and sleep. In Jamaica, you couldn't wear your uniform crush because you'll be sent home. In Jamaica, there's so many things that are there that I miss. The only reason why I left Jamaica is because of resources, lack of resources and opportunity that I needed in America to pay for my student loan and actually progress a little bit more.